If you are pregnant and experiencing signs and symptoms of premature labor between the weeks of 20 and 37 weeks gestation, with signs and symptoms such as contractions occurring every 10 minutes or less with or without pain, low abdominal cramping with or without diarrhea, intermittent sensation of pelvic pressure, urinary frequency, low backache, increased vaginal discharge, or leaking amniotic fluid, your doctor may prescribe Terbutaline.
Labs are back, and before I tell you anything, I'm just going to listen to your stomach. Confirmed, ma'am, you're pregnant.
What?
You're 4 months pregnant.
What? Come again?
4 months pregnant.
Nurse, help!
What? Oh, hey, how are you? How far along are you?
What do you mean, how far along?
You're pregnant, aren't you?
No, I just like to eat.
Oh.
Damn. Can you tell us anything about, like, the craziest pregnancy you had to deal with?
Well, right since I walk in, at the distance, I see my wife split open, and I'm like, oh my gosh, is that normal? So, out of the first pregnancy, this is the outcome of my little mini-me right here.
Do you know anything about terbutaline?
No, my physician hasn't told me anything about that medication. Is that
Okay.
something I should be concerned about?
It's basically what it is. It stops preterm labor. So it's just a drug that's an option that they give you if you come in with preterm labor.
So, which labor, true or false, do you think walking helps? So if you start having contractions and you walk around and it helps, do you think you're in true labor or false labor?
It seems like that might be true labor if it actually helped kind of ease the stress of the situation.
Okay, well actually, we learned that in false labor, if you get up and walk around or if you lie in a warm bath, your contractions would actually get better, and that's a sign saying that it is actually false. So if you start to walk around and you still experience the contractions, then that is a sign of true labor.
Okay, I will have to keep that in mind.
I have one 15-year-old boy, and I'm 35, so that means I had him when I was 20, and I was a virgin until I was 25, so I don't know how that works. I guess the first craziest thing that I had to deal with was she asked me to marry her when she found out she was pregnant. And she was already 6 months pregnant. No, I'm just like... She wasn't really always hungry, but she was always pissed. So.
At you? Or
The
just
world.
just the world?
Yeah.
How did you deal with that?
A lot of overtime.
Terbutaline is a toxolytic. It is used to stop preterm labor or labor before 37 weeks. The 4 major side effects are nervousness, palpitations,
My heart.
tachycardia, nausea and vomiting, pulmonary edema.
I can't breathe.
After administering terbutaline, the major nursing concerns are to assess vital signs, breath sounds, fetal heart rate, contractions, and maternal response.
Major side effects of terbutaline include nervousness, palpitations, maternal or fetal tachycardia, nausea and vomiting, and pulmonary edema.